Mothers in a Homeless Situation. My name is Rachelle Nash, and I am an Indiana State University nursing student. This is for the course NURS 444. My population at risk consists of single homeless mothers. I believe this population is at risk as they are limited in where they can safely go with their children. These mothers are at a higher risk of injury or harm and a lack of preventative as well as necessary health care. The learning objectives include critiquing why homeless mothers are an at-risk population, identify at least 2 rationales where a mother could become homeless, list 1 resource available for homeless mothers, and demonstrate 1 example on how homelessness and one's health interrelate. An outline of this presentation includes the title of my population at risk and a pretest, defining homelessness, discuss why homeless mothers are an at-risk population, discuss what can cause mothers to become homeless. We will discuss statistics, relate homelessness and preventative and necessary health care. We will discuss how healthcare providers can assist, and then I'll list some resources. I will now pause for a brief moment so you can take the pretest. Homelessness. What does it mean to be homeless? To be homeless is to not have a permanent place to live, not having a place of your own, basically. At endhomelessness.org, it defines homelessness as people living in a place not made for human residence, such as under a bridge. Also, the definition can include those in an emergency shelter or those in temporary housing. What leads to homelessness? There are multiple reasons that a mother and her children can become homeless. To list a few, domestic violence, lack of school education, mental health problems, loss of a social support system, and lack of or low income. Also limitations on where someone can safely go, which that can also correlate with the domestic violence and a lack of a social support system. Why are mothers an at-risk population? Homeless mothers are high risk for injury. These types of injuries could include external factors such as rape, violence, sacrificing their food and blankets for their children, and so on. Homeless mothers are at risk for a lack of preventative as well as necessary health care. They may not have the transportation or resources, including insurance, to obtain the health care that they may need. When it comes down to preventative care, that is most likely low on the list of things that a homeless mother is concerned about. Just to give you a few statistics, endhomeless.org reports that 7.4 out of every 10,000 families are homeless. greendoors.org reports that 84% of these families who are homeless are female-headed. And in 2018, Indiana had 5,471 homeless people. Initiating a peer navigator program in my community. To assist those mothers with mental health conditions, I propose a local peer navigator program. This type of program offers a holistic approach consisting of helping these mothers accept the fact that they have a mental health condition, self-recognition that they can take control of their circumstances, even if that means accepting aid, and embracing a reconstruction or recovery type of mentality. Corrigan et al. Performed a study involving a peer navigator program in an African American community, and the participants showed a momentous improvement on their mental and physical aspects. Windrose Health Network is a federally qualified health care center that offers assistance such as a food pantry, transportation to doctor's appointments, blood pressure cuffs to those who cannot afford them, and sample medications. We also have a patient navigator who can assist in obtaining insurance through the government for the mother and her children. As a nurse working in a primary care setting, I will be knowledgeable of homelessness, and I am in a prime setting to acknowledge those at risk for homelessness. Therefore, I will inform those patients of community resources available to them. Personal values and beliefs. From a personal note, I have been in an abusive relationship. I had to leave the home, but was fortunate enough to stay with a family at my church. I choose to not judge others. We are not all the same. We have not walked in every circumstance another person has walked in. Based on my personal experience, I feel that I am able to relate to those some of those facing similar challenges. I will be there for support and to provide patients education, as these interventions will assist in the holistic delivery of care that nurses strive for. Lifelong nursing practice. It is important as a nurse to understand the need to continue one's education. The world and our local communities are an ever-evolving place. New policies are formed. The financial aspect is always a concern. We must continue to balance quality health care along with the means to provide the care. Involving the communities in a neighborhood meeting to find the needs and collaborating with local agencies can assist in meeting the goal of quality, affordable health care. My commitment. As a licensed practical nurse working towards obtaining my bachelor's degree in nursing, I am making a commitment to actively participate in my community. I will strive to set a good example and promote a healthy lifestyle in my community. In addition, I will continue to build a functioning, productive relationship with other community partners so that through collaboration, we can provide holistic care in our communities. It is now time to take the post test, and there is also an answer key attached. Hope you enjoyed.